So in today's topic, we will be discussing with medical errors in nursing or medical errors in general. Okay, those who have the textbook, please mention the page number in the chat box. And if anyone is joining late, please help them out with the page number or topic name in the chat box. So medication errors, before moving to the types of medication errors, that result from medication errors are not just tragic for the patients, but also for their families and also for healthcare professionals who are responsible. Okay. So there are many types of medication errors that can occur anywhere in the healthcare system, from hospitals to nursing homes. Even at pharmacy level, medication errors can take place. Okay. So 70% of the individuals who have taken at least one medication per day, okay, they all have experienced some or the other form of medication errors. Okay, it has happened to everyone. Almost 70% of the people who take any type of medicine on a regular basis, okay, some or the other form of medication errors have taken place. Okay, it can take place even along the route of administration, from the clinician who has or a doctor who has prescribed the medication, or even the healthcare professional like nurses who have administered the medication. At each and every level of this treatment and care or diagnostic purposes, medication error can take place. Okay. So the first one is prescribing errors, wherein a selection of a drug is incorrect based on the patient's allergies or other indications. Okay. On top of that, wrong dose, wrong form of medication. Okay. Quantity, route, concentration, rate of administration. Okay. These can also be prescribing errors. Okay. So prescribing errors is usually from a mistake from the physician's part, or whoever is prescribing the medication from their part. It is wrong. Okay, you didn't diagnose the patient well enough, or the patient's situation was not concluded in a better way. That's why prescription errors can take place. Then you have omission errors, in which there is a failure to give a medication dose before the next one is scheduled. You have omitted. Okay, you forgot to give one medication before another. Okay. Then you have wrong time errors, wherein a medication is given outside the predetermined interval from its scheduled time. For example, morning 8 a.m., a medication was supposed to be given. You give the medication at 10 a.m. So obviously it is outside the determined time. Wrong time you gave the medication. When it was prescribed at that particular time, you didn't give the medication. So that's the wrong time error. Then you have improper dosing error, where a greater or lesser amount of the medication is delivered than it is required to manage the patient's condition. Okay, either you overdose the patient or you underdose the patient. Okay, so anything can happen. Too much of medication, too less of medication. That both ways it is an improper dose. The correct medication was chosen, but the dose was wrong. Okay. Then wrong dose errors, wherein correct dose was prescribed, but the wrong dose was administered. Okay. Doctor has given the correct dose in paper, in written. Okay, 10 mg was supposed to be given. But while administering, while giving that dose, some mistake happened. Either you gave only 5 mg or you gave 15 mg. But on written in the medical record, it was correct. It was a appropriate dose. But while giving, wrong dose was given. That is wrong dose errors. Then you have the improper administration techniques error, such as administering a medication intravenously instead of orally. Okay, a medication that was supposed to be given in an IV form, you gave it in a oral form. Okay. Then you have the wrong drug preparation error, wherein a medication is incorrectly formulated. That is, it is too much or too little diluting solution was added. Okay, like some medication you have to prepare at the nurse's desk and then administered. Okay, maybe you may have to add some electrolytes. Okay, you have to add some multivitamins to a medication and then give it. Or when you're making an NG tube feed, you have to add some medications into it and then give the NG tube feeding. So drug preparation time, something mistake happened. Okay, either you put too much of medication, too little of medication, or you gave the wrong medication, or you formulated the wrong way. Okay, so that is wrong drug preparation. Then you have fragmented care errors. There is a lack of communication that exists between the prescribing physician and other healthcare professionals. So that is fragmented care error. So a one person in a multi-specialty treatment center, a single patient is admitted in the ICU, there could be different doctors from different consultancy team working on the same case. Okay, maybe there is a nephrologist, a cardiologist. Okay, both are working on the same patient. But if there is no proper communication between these two specialists who are working on the same patient, that could lead to errors in prescription. Okay. So these are the different types of medication errors. Then causes of medication errors. You have distraction. A nurse who may be distracted, she can read diazepam as diltiazem. Okay, they almost are like look-alike, sound-alike drugs, diazepam and diltiazem. So the outcome may not be that insignificant. Okay, if even if you accidentally give a patient diazepam, your patient may go into a state of sedation. Okay, and if in worst case scenario, if the patient is allergic to diazepam, it will be another medical complication. So distraction is one of the major cause. Okay, you're distracted, you don't read the medication name properly. Okay, or even if you have the correct medication, the dosing is not proper. Then your environment, a nurse who is chronically overworked, okay, can make medication errors just because she's exhausted. Okay, on top of that, on top of the exhaustion or utter tiredness, there may not be a proper lighting in the ward. Okay, the AC temperature may not be working properly. Many environmental factors can come into play, which can lead to distractions. More distractions means more medication errors. Then lack of knowledge or not able to understand the medication. Okay, before even if the doctor has prescribed certain medication, it is the nurse's responsibility to understand what is the diagnosis of the patient, and what exactly why is this medication being prescribed to this patient. Okay, the nurse should know the why and how of every prescription. So if she does not have the knowledge about the drug, that is being prescribed, or if she does not have the understanding of the diagnosis that has been made, that could lead to further more issues or medication errors. So it is better to learn about your patient's diagnosis, especially for freshers, new staff nurses. Okay, learn about new diagnosis or whatever you have forgotten during your college days, brush it up back. Okay. And if you have any doubts, ask, clear that doubts, clarify that doubts with the doctor. Incomplete patient information, lacking information about which medication a patient is allergic to. Okay. Other medications the patient may be taking, which can interact in a bad way with the ongoing medication. Okay. So these are the results of fragmented medication errors. Okay, not having a complete medication patient's information. Okay, as a nurse, a nurse should know that these many specialists are working on this particular case. Okay, so whatever medications they are prescribing, it should not adversely affect the patient's health. Okay, this knowledge, this basic knowledge, a nurse should have. So if the doctor is prescribing specific medication, she can also point out to the doctor that the patient is taking other form of medications. These are the medications the patient is taking. Should it be a challenge? Okay. So nurses who are not sure about the patient's condition or not sure about the particular concoction of the medication that has been given to the patient, ask the patients, ask the doctors, cross-check with them or cross-check with another nurse. Then memory lapses. The nurse may just forget that a patient is allergic. And usually again, distractions are the main cause of it. Then systemic problems, that medications are not properly labeled. Medications with similar sounding names are placed in a very close proximity to each other. Okay. Lack of barcode scanning system. These things can lead to medication errors. Okay. Llama, sound like, sorry, not llama, sound like, look alike, LASA. Drugs are kept together in the medication cabinets. So these things are systemic problems, which once, even if it is in a way it was inherently wrong, if the nurse has the awareness, she can change the places of the drugs. Okay. So preventing medication errors, how can you prevent this kind of situations? So know the patient. This includes patient's name, age, date of birth, weight, vital signs, allergies, diagnosis, current lab results. Okay, these things should be known. Workarounds, like some nurses create potentially dangerous workarounds to avoid scanning the barcodes. Don't make this mistakes. Always scan the barcodes, arm barcodes of the patient, so that patient safety can be ensured. So you should know the patient well. And if you don't know the patient well, if you're a new nurse, new to the shift, okay, patient's arm barcode will have all the details. Scan it, get the details in front of your screen, understand the condition of the patient, understand what all medications are going on, then make a sound judgment. Then know the drug. Okay. All the nurses need to access the accurate and the current readily available drug information. Even if it is a computerized information, always learn about the drugs. Each and every medication that you administer, you should know the mechanism of action, side effects, contraindications, indications. Okay, these basic things you should know. You should always learn about it. Even if you forget, keep brushing up these knowledges. Okay. And if you have any queries or questions or concerns about the drug, okay, don't ignore your instincts, ask about it. Okay, speak up about it. Keep the lines of communication open. Whenever there is a breakdown in the communication, because it is a healthcare team who is working on the patient, okay, doctors, nurses, pharmacists, other people, physiotherapist, okay, specialist, everyone is a healthcare team who's working on a single patient. Okay, so if there is any breakdown or any barrier in the communication, that could also potentially harm the patient. Okay, so keep the barriers away. S bar or is bar can be ISBAR. Okay, that can also be used. In the textbook, they have only mentioned S bar, but there is one more step. I. It starts with I. ISBAR is bar. Okay, I stands for introduction. That is not mentioned in the textbook, but introduction is an important play here in the communication, because you have to introduce yourself to the patient that I am the nurse for this shift. If you have any issue, if you have any doubt, if you require my help, okay, call for me, I will be available. Like this, you have to introduce yourself, and also introduce yourself to the colleagues, okay, who are in the night shift. You will be taking care of so and so patient. This is your name. Okay, this is your specialty. You have to introduce yourself to towards the situation, okay, and the people around. So that is the first step, I. And then starts the situation background assessment recommendation. Okay, for example, so you enter the ward and you see a situation in which your shift has started, and in the beginning itself you see that a patient is complaining of chest pain. Okay, now it is your new shift, okay, and it's a new patient. You do not know this patient well. Okay, it's your first approach to the patient. Okay, so what you will do? You will go and check the background. That B stands for background. So you will go to the medical records of this patient who is having a chest pain. Take that medical records, read about the patient. Okay, what did the patient what is the patient diagnosed with? Okay, what medication is going on? What complaint the patient is having right now? Okay, so in the background, you said you saw the medical records. You see that the patient is having had a hip surgery done. Okay, but just now the patient started complaining about chest pain. So there is no association between hip surgery and chest pain. And when you check the vitals, nurses can check the vitals, monitor the vitals. So the vitals are quite high. Pulse rate, breath rate is quite high. Okay, there is discomfort, chest pain. So, and you see the pulse oximetry, oxygen saturation is also falling. So you don't require a doctor here to come and tell you put on the oxygen mask if the oxygen saturation is going down. Okay, so you assess the condition that these things are happening in the vitals. What immediate life-saving measurement you can take so that the patient is alive by the time the doctor arrives, or patient's discomfort can be eased a little bit by the time doctor arrives. So you assess the condition, and you see that the patient may be having a heart attack because chest pain is there, shortness of breath is there. Okay, now the pulse rate is very high. So these can be an event, a cardiac event. So immediately, what you will do, what is the recommendation to be done in this situation? You immediately put oxygen mask on the patient, and you immediately start an analgesic, that is painkiller for the patient. Okay, and immediately call for code blue. Okay, these things are recommendations to be done in this situation. Okay, so that is an ISPAR. So in this way, you can prevent any medication errors. Double check high alert medications. Okay, you can use a mnemonic called A-pinch to understand what all are high alert medications. Okay, A stands for anti microbials. Okay, anti-infectives, antimicrobials, all anti-infectives, antibiotic, antivirals. Okay, P stands for potassium electrolytes or any form of electrolytes. I stands for insulin. N stands for narcotics. C stands for cytotoxic drugs, chemotherapy drugs. Okay, H stands for heparin or any anticoagulant drugs. These are the high alert medications. So always be very vigilant. Whenever a high alert medication is been prescribed, or if you're administering, always double check. Okay, because high alert medication, if given to the wrong patient, wrong dose or wrong route of administration, it can lead to death. Okay, so high alert medications should be when drug manufacturers are manufacturing it, large labels should be used. Okay, different colors should be used to distinguish the high alert medication from regular medication. Put them secure in a separate cabinet. High alert medications should have a separate cabinet. Be vigilant about the dosages that you give on high alert medications. Then document each drug administered. If you don't document it in medical record, it is as good as you have not given the medication. Okay, what is not documented is not done. That is what we consider. So each and every drug that you document with the time and who administered it, what route of administration was used, these things have to be documented in the medical record. Then take active role in correcting issues if you identify. If you see that look-alike or sound-alike medications are stored in cabinets next to each other, ask your in charge to separate them, or you yourself can take an initiative to separate them. Okay, to actively separate the medications. Inform the patients about the drugs that they are receiving. Patient should know what medications they are taking, because if the patient has an idea of how much count of medication they are eating, okay, it will give them the idea that if a nurse is not giving a medication, the patient can ask, one medication is missing. I regularly have 3 medicines at this time, but you have only given me 2. Okay, so like that, then sometimes the patient can also correct the administering healthcare professional. Okay. Then ask for continuing education. It's mandatory. Training sessions about medication has to be continued for all the healthcare professionals, not just doctors, but also for nurses. Policies, procedures, protocols, these things are updated every now and then. Newer updates has to be taught to the healthcare practitioners. So that's about medical alerts in nursing. If you have any queries, you can mention in the chat box.